Hi everyone, welcome to episode 20 of Let's Talk Mental Health. On today's episode, we will be talking about bipolar disorder. Bipolar disorder is a mental health condition that causes extreme mood swings. This is where the person experiences emotional highs, also known as mania or hypomania, and lows, also known as depression. Bipolar disorder can be diagnosed at any age, but is mostly diagnosed in the person's teenage years or their early 20s. Symptoms may differ from person to person, and it can also be different over time. When the person becomes depressed, they tend to get sad, they feel empty, hopeless, worthless, having little to no energy, always tired, angry, hostile. They also tend to lose weight when they are not dieting, or they gain weight by overeating. They also tend to sleep too little or too much. They have a hard time focusing or even making sound decisions. And then eventually they start to plan or think about suicide. So when the mood shifts from depression to hypomania or mania, they feel excited, happy, they are energetic and unusually irritable. This is where the person will start to talk too much, or they start talking fast. They have racing thoughts. They're jumping from one topic to the next. They have a lot of energy and they don't even see the need to sleep. They are easily distracted as well. They also make poor decisions and they have this distorted sense of well-being, or they feel too self-confident. These mood swings, which are the depression, hypomania, and mania, they affect the person's sleep, energy, activity, judgment, behavior, and ability to think clearly. We move on to symptoms of bipolar disorder. There are different kinds of bipolar disorder. The first one is bipolar 1 disorder. This is where the person has experienced one manic episode that may have come before or after the hypomanic episode or the major depressive episode. Remember, mania or hypomania, as we discussed previously, they are the emotional highs, and major depression or major depressive episodes or just depression, they are the emotional lows. So mania is very severe than the hypomania. Mania can cause a person to go into psychosis where they take a break from reality. What we normally say in library, the person is crazy. So this causes the person to, seek help at a mental health hospital until they can regain their senses. The second type is bipolar 2 disorder. This is where the person has experienced one major depressive episode and one hypomanic episode, but they've never experienced manic episode. Now, bipolar 1 and bipolar 2 disorders are separate diagnoses. There is no one is greater than the other or one is lesser than the other. They are separate diagnoses. The third one is cyclothamia. This is where the person has experienced at least 1 or 2 years of many periods of hypomania and depressive symptoms. Then the fourth one, we have other types of bipolar disorders that usually comes about because of a certain type of drug that the person have taken or because of a medical condition. Now we'll move on to the causes or the risk factors of bipolar disorder. The first one is biological differences. People with bipolar disorder appear to have a certain physical change in their brain. The second one is genetics. People who have bipolar disorder have a first degree relative. It's either they got it from a sibling or a parent. A parent or a sibling had the bipolar disorder, so it passes on to the next person. And then periods of high stress, that's the third one, maybe from a death of a loved one or a traumatic event. And then the fourth risk factor is alcohol and drug misuse or abuse. Although bipolar is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In a healthcare setting, bipolar is treated with medication and talk therapy. also known as psychotherapy. So follow your treatment plan if you have bipolar disorder. Pay attention to your warning signs. Do not abuse alcohol or drugs, and also take your medication as directed. If they did not tell you to reduce the dosage, please do not reduce the dosage. If you feel like you have bipolar and you haven't been diagnosed, I recommend that you go to a mental health facility so that you are diagnosed and you start your treatment as soon as possible. And that's about it for today's episode. I hope you learned. Remember, an informed mind leads to a changed behavior. I'm Reverend Smallwood, a clinical social worker. And until our next episode, adios.